Hey, I'm Dr. Hampton Howell, board certified plastic surgeon at Salem Plastic Surgery, and we're talking through some questions today on mommy makeover, and hopefully you'll find some of these helpful.
Should patients wait until they are done having children to have a mommy makeover?
Good question, and it really kind of just depends on what you actually mean by mommy makeover. So in a general sense, mommy makeover's kind of gotten that name because babies are great, but they do kind of mess with the body a bit. And it's generally kind of combining some form of breast surgery and some form of abdominal surgery. So for instance, if a patient was still planning on having children, but maybe her abdominal portion of a mommy makeover was more doing like say just liposuction, for instance, then it's perfectly reasonable to go ahead and do that before being done having children, because you can get the benefits of the liposuction by reducing that fatty tissue and that type of thing. And then when that patient's done having babies, they may have gotten enough stretching to where they end up needing a tummy tuck. And even that's not really wasted effort, because by having already thinned the tissue out there with liposuction, if they choose to have a tummy tuck later, then you can actually end up even with a little bit nicer result from the tummy tuck, you know. But if a patient's still planning on having children and they're wanting to do the tummy tuck portion of it, I typically tell them to wait, because they're probably going to just stretch things back out and then, you know, have to kind of redo things.
What should a patient expect during a mommy makeover consultation?
So basically, I go through everything real thoroughly. You know, first is making sure medical-wise we've gone through all their medical history, make sure you're a healthy patient, make sure there's not reasons that we need to be concerned about doing surgery at all or doing a longer surgery. And then basically we get right at what are you looking to have improved on, because for one patient, the breast may be too large and they want them reduced. Another patient, they're the size they want, but they're drooping and they want them reshaped, which is a breast lift or a mastopexy. Another patient, the breasts are too small and they may need a breast implant or an implant in addition to lifting and reshaping to get them to where they're wanting. So you can have the whole spectrum, even just in terms of breast surgery, for instance. And then kind of similar thing with the abdomen. If somebody has extra skin that's kind of stretched out in addition to the extra fatty tissue, we may be looking at doing the tummy tuck and some liposuction of the flanks as a combination, in combination with the breast. Somebody else may just have an extra, you know, cooching of the fatty tissue, good skin elasticity and those kind of things, and really just need some liposuction to bring it in. Sometimes we do smart lipo, which is liposuction, but then in addition, laser energy on the inside to try to help tighten up the tissues more than what you would expect them to do without smart lipo. So it's a bunch of different combinations, and if you sit back as somebody who's not real familiar with it, which many patients aren't, and that's my role is to educate you on it, the combinations can be kind of dizzying. And so we really just kind of try to, you know, narrow it down and say, here's what I'd recommend, and we just have a good mutual conversation and come up with a plan that works, you know, well both ways.
What does recovery typically look like?
So that's a real common question. I always find it a little bit hard to answer, because it's not just a set, okay, there's your recovery, you're done, you're good. At some point there is, but it's a thing that goes in stages along the way. So most of the time with this, like say we're talking about, you know, whichever breast surgery like I just mentioned, and maybe a tummy tuck, like 6 to 8 weeks of no heavy lifting, no strenuous stuff like running and stomach crunches and lifting with the arms and everything in terms of like, you know, strengthening stuff. But I really want to restrict you as little as I can, because I want you to be able to get on back into things, but I want to restrict you enough so that you heal well. So very often I'll have you walking right after the surgery, almost always, even that night, just a little bit around the house and those kind of things. And the days after, the more gentle, easy walking, the better. And usually about every 2 weeks, I let a patient do a little bit more and a little bit more. Maybe something where you're just, instead of doing a boring pace walk, you're walking a little more briskly, and another 2 weeks, even a little bit more. And a lot of times you can do a lot of different kind of flavors of exercise that are within the restrictions. For example, you could do an elliptical without using the arms, or you could be even on a Stairmaster where these gentle fluid motions, but you're not overdoing it, and you're not doing the pounding, you know, of running, or you're not doing all this, you know, heavy lifting and stuff. So again, it kind of goes in the stages, and then we try to let you do as much as I can, you know, as soon as we can, because you're just going to feel better and do better. And then ultimately, obviously, when you're well enough healed, then no restrictions on anything, do anything and everything that you want.
Should patients expect to have someone at home to care for them for a prolonged period of time?
Not what I would consider prolonged. So for sure, somebody needs to be with a patient for minimum 24 hours just because of having had a surgery and anesthesia and everything. And then everybody is really a little different. I mean, even things like, pain is different for different people, how quickly they're bouncing back. And so I really let each patient kind of determine with their, friends or family who are helping them. But most people are going ahead and getting on up and about, on their own. They're, reaching and grabbing plates and silverware and all these practical things of just kind of getting through a day. But especially in the earlier bits, being able to have somebody who could, come and give you a hand if need be on a fairly short notice by, cell call or something like that is always, helpful and stuff. But people pretty quickly in those first like 48, 72 hours get to kind of figuring out like, yeah, I'm really doing pretty much all this stuff on my own. I'm not having to climb 50 flights of stairs or something. I don't need somebody giving a hand with that. And they can kind of help navigate through that. So hopefully that's helpful. Those are a lot of the common questions with mommy makeovers. There's plenty of other questions out there, and at your consultation, that's obviously the point of it, is to answer all those questions and give you all the advice. It's a real fun procedure. It's got a lot of benefit to it. You can certainly take the two different combinations and separate them and do them separately if you want to. But in the right patient who's healthy, doing the combination can be real beneficial and wrap your recovery into one and get things all tuned up for you. So I hope that's helpful. We look forward to seeing you. Have a good day.